my previous video, I was speaking about the microbiome and how your state of being could essentially influence your state of health and disease, right? We tend to look at health as if it's something that is fixed, as if it's isolated and it's one singular state. And we have, like, on the flip side, disease. So it's like we think that it's like either or, you're either healthy or you're diseased. Reality of it is that a lot of human physiology depends on regulation and adaptation. Because I wanted to touch on the comparison between a psychological behavior where you try to come back to your state of order when you are faced with a experience that brings you a lot of discomfort, even though it is good for your growth. When you tend to revert back to your previous condition or your previous order, that's because that's where you feel most comfortable. But by doing so, you're actually avoiding what Dr. Goldstein refers to almost as a catastrophic event, because you associate it with feelings of anguish. But by doing so, you're keeping yourself stuck within a self-perpetuating loop of survival mode by avoiding that type of feeling. So you're stuck in your comfort zone, essentially. He mostly talks about the catastrophic events in health and disease, where if you're trying to essentially preserve life, that you are actually keeping yourself within a survival mode, because rather than accepting disease as a normal state and a normal flow of life, that you're actually withholding your expansion. And I say expansion when referring mostly to psychological behaviors or growth in terms of how we become who we want to become and achieve higher levels of abundance, let's say. But when it comes to health and disease, it's more about accepting a new order of regulation and adaptation. So you work with what you have and the environment that you have now, rather than trying to revert back to your previous order. Because once you've established a pattern for or behaviour, it's very hard to erase. So you have to replace it with a new pattern and a new regulation and new behaviour. And that's not to disregard like the levels of pain that someone would feel in an illness. It's more to say that there is, at least in this body of work, a difference between patient sickness and doctor's sickness. It's when you finally sort of associate yourself with a particular condition that it can reinforce repetitive or stereotyped behaviors that are not beneficial and keep you held in a particular state of mind or state of being. And if your internal state can have such an effect on your biology, and it could work in a like bidirectional manner, you can see how the system would be able to sort of sustain itself in that way. And there's a fundamental like middle ground between the state of your old order and comfortability and new order and uncomfortability, where you sit in the middle of them. And the same as sitting in the middle of health and disease. If you imagine them both being like a pendulum swing and you're the core, what holds you in the core between both of those situations seems to be this idea of self-realisation, which is interesting because core principle of, well, behind mind-body medicine is how emotional and psychological and social factors affect health, but also how spiritual factors affect health too. Having the death of the ego almost in self-realisation allows you to set new aspirations and achieve higher goals, rather than trying to preserve or go backwards. Instead, you expand or you adapt. So it could be a reason why there's a few studies at the moment into mindfulness being a good practice for your state of health, but also aligning your actions with your core values in the state of psychological well-being too.